Why are surgical margins important for DCIS? Imagine trying to clean up a spill on the floor. You want to make sure you've cleaned all the way to the edges so no stain is left behind. That's similar to what surgeons aim for when removing ductal carcinoma in situ, or DCIS, from the breast. Surgical margins are the edges of the tissue removed during surgery. If no cancer cells are found at the outer edge, it's called a negative margin, meaning the cancer has likely been fully removed. But if cancer cells are present at the edge, it's a positive margin, which suggests some cancer might still be in the breast. Why does this matter? Because DCIS is a non-invasive form of breast cancer that stays within the milk ducts. If any cancer cells remains after surgery, there's a higher chance that the disease could come back in the same breast. Achieving a negative margin reduces this risk significantly. Current guidelines recommend that the margin should be at least 2 millimeters wide for DCIS treated with breast-conserving surgery followed by radiation therapy. This 2 millimeter margin is based on research showing that local recurrence rates are lower when margins are at least this size. Interestingly, making margins wider than 2 millimeters doesn't seem to provide much additional benefit, so surgeons usually aim for that standard. If the margins are less than 2 millimeters but still negative, the decision to do more surgery depends on other factors. For example, if radiation therapy is planned, close margins might not requiring further surgery. But if radiation isn't part of the treatment plan, additional surgery might be recommended to lower the chance of recurrence. On the other hand, if cancer cells are found right at the edge of the tissue removed, it's called a positive margin. This situation increases the risk that some cancer remains and could grow back. That's why surgeons try to remove all the cancer with clear, negative margins to give the patient the best chance of a successful outcome. In simple terms, surgical margins are a key part of managing DCIS because they help confirm that all the cancerous tissue has been taken out. Negative margins of at least 2 millimeters are linked to a lower chance of the cancer returning. Positive margins or very close margins mean a higher risk of recurrence, which might lead to more surgery or other treatments. The goal is to find the right balance, removing enough tissue to prevent cancer from coming back while avoiding unnecessary surgery. Understanding the importance of surgical margins helps tailor treatment plans to each person's needs, improving outcomes and quality of life. Always remember, discussing your specific situation with your healthcare team is essential because each case is unique and requires personalized care.